don't want to bore everybody. What if they don't care about?
Then they can.
What if they don't care about any of this?
They don't care about their boobies. I care about my boobies.
I know. I mean, hopefully women care about their boobies.
And if they don't care about this, they just can't listen to another podcast.
Right.
Where they talk about reality TV and This is not that kind of podcast. We're raising awareness.
That's true. This is a lot.
We're going to have fun. Emma was like, are you going to send me questions? I'm like, no. It's not like a conference where I'm asking you.
Okay.
Or I'm asking you like really technical.
I don't know. I just want to know.
First of all, I didn't know you were a microsurgeon.
Yes. Well, most people don't know what that is, so it doesn't matter.
That's the sick thing. We're going to talk about that. I don't know what it is. You'll tell us.
Okay.
You do microsurgery?
Yes.
Does that mean you do little things?
Little things. School for ants.
You do. You do the little things and you step away and they do the big things?
Yes.
Wait, really?
That's exactly it. No, it means we use the microscope and we operate on we connect little blood vessels. So that's why it's micro, because you have to use the microscope.
Did you know that?
They're just small.
I've never heard of that.
There's just small blood vessels. Okay.
How's the belly?
The belly's uncomfortable.
It's
working so hard to hide the belly.
Why?
Mostly because I just don't want to talk about it with like every single person. I like when you work at a hospital, you see like 100 people a day, and I don't want to talk about it with every single person. So it's easier to just like upsize the scrubs and just not deal with it.
How long do you think you can get away with it?
I mean, people like everyone that I like talk to routinely, like obviously knows I'm pregnant. It's just like every time I see a clinic patient, I don't want it to be like,
Oh, now I feel bad because like our pediatrician was so pregnant at the last visit, like about to pop. And I haven't seen her in a year, so I didn't know. And this is her third.
Oh, wow.
So I had the whole
No,
talk.
I'm sure she wanted, like, if she's a pediatrician, she probably loves it. I'm sure it's
Who
like,
knows?
Yeah.
2, 3, 4.
Hi, everyone. Welcome to the Village Pod with Dr. Naz. And I'm with a real doctor today.
You're a real doctor.
Thank you. It actually took me like 3 months to explain to the country of Turkey what a PhD was. Hi, Emma.
Hi, Naz.
So Emma and I went to college together. This is slowly turning into a Princeton podcast. But yeah, Emma and I went to college together. And now Emma is a plastic surgeon.
That's right.
Some of us, chilled in LA and some of us became microsurgeons. I was going to say welcome to the pod, but
Thank you for having me. I'm so excited.
Well, thanks for having us in your office. It only takes us an hour to set up, but we did it. We're here. We're doing it. It's nice to be back. I used to take classes here, not at Keck, but somewhere really close by, the School of Public Health.
Oh, yeah.
Isn't it around the corner?
Yeah, there's a bunch of buildings clustered around here.
With Dr. Valente. He was like on my, the committee for my dissertation and all that. So I used to come here a lot.
Oh, wow.
As a patient and as a student.
You know the deal then.
A little bit. New Starbucks. Everything looks great.
Yeah.
How are you feeling?
I'm good. I am, as you know, 7 months pregnant. So that's been a nice little cherry on top. No, I'm doing really well.
How's this pregnancy going compared to, because this is Emma's second baby.
Yes.
Compared to the first one.
This one is harder, which as I've been polling all my friends about their second babies seems to be the consensus. Yeah, I don't know if it's because I'm older or because I have the first baby to take care of, but I'm just so much more tired and it's just not as much of a cakewalk as the first one.
Could it be being a surgeon and a mom?
There's that too. There's that.
No, I was thinking you could have been my parents' kid because my dad's a plastic surgeon and my mom's a breast cancer surgeon.
Oh, I love that. Yes, they are.
So you'd be the ideal child.
That would be a dream. That would be a perfect
taken over
practice.
The clinics and it could have been a nice life for both of us.
Oh my gosh, so many referrals.
Right? I was saying that because I remember my mom also working so hard. She was also on call like the first half of my life, I guess. She was the chief of ER. So she just worked these insane hours.
Yeah.
And now as a mom of two, I don't know how she did it looking back. But then you're doing it. So you can tell us how you're doing it.
I think when you're a mom and no matter what your job is, because there's all sorts of hard jobs out there, I think you just do it because you're just used to doing hard things and you have to do it. And they're like, no one else is going to do it for you. So you just do it and you don't know any different.
I like that because I love the phrase, we can do hard things. And that's something I tell everyone all the time.
Yeah.
And I say that to River every time he's like, "Ee." I'm like, River, you can do hard things.
Oh, I love that.
And the other day, I don't know if you saw it on my stories, they did this like perseverance exercise at school where the teacher asked everyone like, what do you think of when you are struggling? And River's quote was, I can do hard things.
Oh my God. That's incredible.
But I cried. I was
okay,
like,
mom of the year. See, now I feel like I'm not a good enough mom because my kid doesn't say that.
Your kid is 3 minus 5. It's a really big difference. But I was like, oh, I did one thing right.
Yeah.
Does it undo all the screaming and all the things I do? Maybe. I hope so. Emma, in college, I don't think we were super close. We were in the same friend group, but I remember you as this like super cool girl with like.
That's not how I remember myself.
No, but you were so cool, and you had a million guy friends.
I had a lot of guy friends in college. Yeah.
You were like the cool chick who just like was hanging out with the bros, and we would just be like, how does she do it? Sorry, Hans. These are the truth. It's just all, it's all friendly.
No, those were my buds. They were great. I thought, like, to me, it sounds so cliche, you were just one of the super cool girls, and it was easier for me to hang out with, the bros than with the girls who were more, I don't know, more intimidating.
That's so funny. So we were both thinking the same thing.
Oh, for sure. It's
wasn't
always
true.
like that.
Yeah. Okay. So you're intimidated by us. We're intimidated by you. Okay. We came a long way.
Yeah. We met in the middle.
Oh, yeah. I want to ask you about your journey into surgery. When did you know you wanted to become a doctor?
I definitely got interested in it sort of, around high school, kind of looking at different professions and what I wanted to do. And medicine was really appealing because it was so unknown. There were no doctors in my family. So I didn't really, I didn't know what was out there, but I knew it was something I wanted to know more about. And I liked I wanted to have the information myself because I felt like anytime I ran into something medical, because I didn't have anyone on speed dial, it was a total, a guess of what to do. And you're looking on the internet and you're trying to make these doctor's appointments. So it was something that I wanted to feel empowered in. And then, you go through college and you're doing the pre-med classes. There was nothing else that sort of deterred me from going to medical school that I found more exciting. In medical school, that was when I found plastic surgery, and more specifically, because I feel like it's so deceptive to be a plastic surgeon in LA, but reconstructive surgery. Close to 100% of what I do. So not doing a lot of cosmetic surgery, mostly doing kind of head-to-toe reconstruction and primarily breast cancer.
Tell us more about that. So what do you mean by reconstruction? I think that my dad used to do that. Now he's fully cosmetic. It's like boobs and butts and all that stuff.
Yes.
But I remember he used to treat like serious burn victims or serious hand injuries. People don't know what plastic surgery is, I think. So maybe tell us what plastic surgery really is, and then we can go into reconstruct. Is that the same thing as reconstructive surgery?
Yeah, no, I mean, you hit the nail on the head. It's all plastic surgery and it's all reconstruction. Even cosmetic surgeons are sometimes doing reconstruction. Mm-hmm. So you do a very broad plastic surgery residency training. It's 6 years of training and then plus minus a fellowship year. So you cover all of that. You do burn reconstruction, you do head and neck reconstruction, craniofacial, cleft lip, palate, babies. You do hand surgery. So hand surgery is part of plastic surgery. Microsurgery, which is what I ended up going into, which is heavier on the reconstructive side because it specifically involves tissue transplantation. Oof. Everyone knows what cosmetic surgery is. It's right. You're just making something look better and faces and boobs and whatever it is. Reconstruction, our starting place is usually sort of there was a problem, something happened, it could be a burn, could be a cancer. So there's something that needs to be fixed. Trauma patients, a lot of the times. My focus is tissue transplantation, where we can take tissue from somewhere else to restore what's missing.
So I just remembered a story. I don't know if this is that. So I actually talked about it in my college application essay too. So I have this memory, I think I must have been 5 or 6, where my dad came home with, what do you call those plastic transparent papers that you put on a projector back in the day?
Oh, I know
what
what
are
you're
those?
talking about.
I don't know. I remember the Turkish. I don't remember. So he had one of those and he put it over one of my ears and he drew my ear with a marker. and said, tomorrow a little boy your age will have your ear. And I'm like, what are you talking about? And apparently there was this like little boy who was born without his outer ear. And
That's
my
such a
dad
cool
was going to
story.
make an ear. I don't know how you
that's
do
what plastic
that.
surgeons do. Yes.
So that was
yes.
and that got me into college. Thanks, Dad. Like that was my opening of the essay because it's such a core memory.
That's such a cool story. Yeah.
So how do you make an ear?
So that's what, I mean, that is like
What you do a little
OG
bit.
plastic surgery.
Yeah.
Yeah. They would mold ears by carving the rib cartilage. So that was now there's newer ways to do it, but that was the way to do it for a long, long time. And it's super cool and everyone needs a template, right? Because plastic surgery, it really is an intersection of a lot of art and design and then the actual super technical aspects of surgery. So you were the template for that.
I didn't
child.
Yeah, I didn't understand what it meant then. Looking back, I was like, I wonder where that kid is. That'll be interesting.
Walking around with your ear.
Yeah, with my ear. What are you doing with my ear? But it's so funny. I like that you said it's an intersection of like art and also medicine because I think my dad is an artist. Like he is a great painter, drawer. He does like clay sculptures really well. Do you have that bone in you?
I kind of just missed it. So my dad is an artist, an architect, and
Wait.
Of course.
And then you married an architect.
Greatest Freudian irony. I married an artist, an architect. I'm not proud of that. But so I feel like it's always been in my life and it's always like it's been around, but I didn't get the bug to draw and I don't have sort of more of those artistic hobbies.
Tell me more about your training. So you did medical school.
Yeah.
And then you did your residency. Did you do a fellowship? You did the microsurgeon.
Yeah. So it was kind of each thing led to another. So I did medical school and I found reconstructive surgery and I was like, this is so cool. This is what I want to do because there's like endless possibilities for what you can do and how you can help people. And then from there, I matched into residency at USC.
Fight on.
Where we are now.
Fight on.
And then during residency, I found microsurgery. So that's, transplanting tissue, connecting small blood vessels using the microscope, which is why it's called microsurgery. And that was what I really wanted to focus on. So I did a fellowship year, just one additional year of super specialized training at UChicago.
Ooh, I remember that little Chicago.
Yeah, it was a fun year.
Yeah, and then you came back here.
And then I got hired back at USC, and then I started my real practice.
You're an attending?
Yes.
That's
That's
you get to
very
wear
good.
the cool white coat. It's a very hard path. It's a very challenging path. What did you have to sacrifice, like financially, emotionally, life plan wise, to become a plastic surgeon?
It's intense. I think it's so much of your 20s when, your friends have a lot of free time and sort of they're getting to figure out their lives kind of on their terms. You are working 80-hour weeks and you are in the hospital a lot and you are working late nights. So I think the time that you give up is really the biggest thing. Obviously, you don't make a lot of money. You kind of just get paid just enough in residency to pay the rent, pay the bills, and get to the next year. But it's really the time that you give up and sort of having the motivation and the dedication to see it through after, it's already been so many years of school. And then you add all these years of training on top of it. And it's a huge commitment. And you see now there's a lot of burnout and there's people who leave medicine if they realize this is not the thing for me.
Yeah. Did it ever interfere with your life plans, like building a family, having kids? Clearly not today, but like the timing of it, did you ever have to shift things around?
It's something that's very much, I think, on your mind during training because I knew I wanted to have a family. I knew I wanted to have children. And I was like, when is that going to happen? Because you also don't want to, there's this idea that you don't want to mess up your training or miss something. So, and you don't want to kind of not be serious about one thing or another. You're thinking about when's the right time to do it and, should I wait? Should I try to do it during training or after? And I think I was lucky to have great female mentors who said there is no perfect time. There's nothing to wait for. If whenever you can do it, whenever things align, the earlier you can do it, sort of the more options that you have later.
That makes more sense and more energy.
Yes. And so I had my first baby at the end of fellowship, which was just so lucky because it was the last month of my fellowship.
Amazing.
I'd done the whole year. year. Couldn't have planned it better. Then now I'm having this baby in my third year of practice. So if I could do it all over again, I would do it sooner if I had the option. But, I think the lesson is to not wait because of something external.
I so agree. My external factor was my then boyfriend, now husband, like not getting it together. I was like, Reed, we need to have children. You are 7 years older. Get it together. Now I'm looking back, God, if I had a first baby at like 27,
right?
I could have a third this year. Oh, God.
Life could be so different.
Life could be so much harder.
Right. Yeah.
What was I thinking? I'm going to talk about partners and stuff, but a little later on. I think I want to go back to the breast reconstruction work. How do you meet a patient? Like, in what part of their journey are you entering their lives? And what does that relationship look like? So from meeting them for the first time until surgery, what are the steps that you go through with a patient?
Because we are on the reconstructive side, we're sort of we're the rebuilders. So patients come to us at all different points in their breast cancer journeys. It's really nice when we get to meet the patients from the get-go. So that's a lot of what happens with like our USC patients. They meet with as soon as they are meeting with their surgical oncologist, figuring out their cancer diagnosis, they meet with us and we talk about reconstruction and what your options are and what the steps can look like and sort of what our goals are and how we're going to get there so that they know from before surgery, where are we trying to get to. Some patients don't have access to plastic surgeons or microsurgeons in particular where they are. So there are some patients we see that had their breast cancer treated years ago and they've either been living flat or they've been living with some sort of reconstruction that's pretty inadequate or painful or, is not adding to their quality of life. And then they find us and we're able to sort of give them all these new options. We follow patients for years. So we really go on these journeys with our breast cancer patients. We always say there's no such thing as a one and done. It's a process and it takes a lot of time.
You're talking about this and I'm like tearing up a little bit because I feel like it's such an emotional and vulnerable period of someone's life.
Yeah.
How do you, God, I'm going to cry. Like, how do you separate the emotion of it all from your job?
Yeah, no, it can be hard. And I think as a young woman and as I see more and more young female breast cancer patients, you really feel for them. And I have so much empathy for my patients and the ones who are young moms in particular, where I know that they have kids at home and they have other responsibilities. I think that's one of the benefits of sort of being a young female surgeon is I can really relate to my patients. I can understand where they're coming from. And I mean, this, but you are a different person before you're a mom and after you're a mom.
Oh my God, yeah.
So, the way that you're sort of able to connect with people and really kind of understand things on a more visceral level is totally different. The goal for us is to really just get the patients to where they want to go in an ideal world, because we are the ones that we are there to help them pick up the pieces after the cancer.
Yeah. From my understanding, it's better if the conversation is had earlier, even before their cancer treatment. What are the options do they have when it comes to reconstruction?
Yeah.
Are there many different methods or I don't know? You tell me.
Yeah. I mean, there's implants. We've all heard of those in LA. So very similar to the implant surgeries that are done for making breast augmentation or enhancing the breast. We use the same sort of implants to replace the entire breast. Implant options have been around for a long time. Those are great. With the microsurgery, which is the tissue transplantation, we can use your own tissue to rebuild the breast. That's something I really wanted to focus on because the whole concept of a woman still being able to have soft, natural looking breasts that feel like her is super appealing. And I think something that everyone, if they are interested in that, should have access to, because implants aren't perfect and they can have complications and people can have problems with them. And being able to rebuild the breast with your own tissue is just a really nice option, especially when our favorite place to take the tissue from is the lower abdomen, where there's a lot
and lipo and new boobs. Sounds great.
It's just a bit like a tummy tuck, but we say it is not a tummy tuck. But, a lot of women dealing with breast cancer have some extra tissue in their lower belly that they wouldn't mind getting rid of. And we can use that and make 2 new breasts.
What makes someone a good candidate for that procedure you just described?
Different places we can take tissue from. So the lower abdomen, the thighs, the lower back. So depending on where we can kind of get a good amount of tissue, that'll determine if we can do that flap surgery, as we call it.
Do you ever have patients who choose to not do this and just stay flat? Is
Yeah.
that okay to say, staying flat?
Yeah, no, that's a great question because
Yeah.
it's getting way more popular now.
And what do you think influences that decision?
I think the world is so much more connected now. And I think a lot of people have heard a lot of different stories about breast reconstructions. So they've heard really great stories and experiences, and then they've heard really not so good experiences with breast reconstruction and having multiple surgery after surgery, and having talked to other patients who have decided not to have reconstruction and to go flat and realized like, oh, this is something I can do. I don't have to, whatever I decide, it's my body and I don't have to have a reconstruction.
Interesting. What do you wish more women knew about their options that they don't hear in time when it comes to this kind of surgery?
That there are, reconstructive surgeons out there who are in network with their insurance who can give them more options. I think a lot of patients meet with one plastic surgeon, maybe none, and don't realize that there are all these things available. So they can't make an informed decision from the get-go, because if you don't know what's out there, then how are you supposed to really know what's right for you?
You need to be informed in the shared decision-making model
100%.
that we learn at school. So for women listening, I want to talk about just slightly, breast health. This is pretty common information. We might think that, but that might not be the case for everyone. What are some things we need to be looking out for our breasts? Any symptoms, signs that we need to be aware of or taking seriously when it comes to our breast health?
Yeah, well, I think it's important to just actually get to know your breasts. So you can't notice small changes if you don't have a good baseline. So I think that's why actually doing your own sort of breast self-exams and just getting to know your breast architecture and what's normal, what's been there for a long time versus what's new. Because it's really those changes that can alert you to something at the earliest moments, even before the mammograms.
Yeah. So after breastfeeding 2 kids, I don't recognize my own boobies, doctor. Doctor, my boobs are flat as pancakes. Sorry, Blake. And they actually feel really weird too. I feel like I can feel what's inside my breasts now.
Yeah.
Like the good, the full breasts are just so I touch a lot of weird tissue there now.
Yeah.
But I actually called my doctor the other day. I said, I want a mammogram and an ultrasound. I'm 35. I have no history of breast cancer. But it just feels so weird to me, my boobs.
Yeah.
I just want to get that baseline mammogram and ultrasound. And she was like, fine. So I'm getting it for the first time next week.
Yeah.
But it is weird. Your breasts change a lot.
Well, those breasts have done a lot of work at breastfeeding
Tell
2
me
babies.
about it.
So they're not the
God.
same.
They're not the same. And it's completely the shapes, the sizes.
Yes,
It's
yes.
we're all over the place. It's
There's
so
a
not
lot of plastic
fair.
surgeons who can help you with those issues.
I know. I asked my dad, which is so weird, and he goes,
so
"Honey, you're
you."
perfect." And I'm like, "This is such a weird conversation. I wasn't gonna show you my boobs, but yeah."
Yeah.
It's I want to come to an age where he says there are options instead of looking great. Come back another time. Ugh.
That may never happen.
I know. It's weird. I wouldn't get operated by my dad. Though, my dad pierced my ears, removed all my moles. Every time I got injured as a kid and got a cut here and there, stitched me
Plastic
up.
surgeons operate on their family members all the time. It's this weird gray area.
Have you?
I have not, because, people are not coming to me being like, I need a nose job. Will you do it? Because I would say no. But it's very common just in this profession.
How about the little stitches and stuff? Did you ever have to give Auden
I've stitched up friends and kids and those sorts of things, yes.
One of my surgeon friends said she uses surgical glue on a daily basis on little
that's funny.
Do you ever do that with Auden? Surgical glue around the house.
He hasn't needed, thankfully. I've used it on my husband.
Of course.
I've definitely used it on my husband. I carry it in my bag.
Can I have one? A tube?
Yeah, sure. You can have a goodie bag.
Goodie bag.
It's great.
Yeah. What is it? Is it pretending to be tissue? What is that?
No, it just creates a waterproof seal
that's
over the incision, and it acts as a final layer of skin closure.
In my mind, it's this super high tech thing
no,
that was
no.
fill in skin. No, it's not fill in skin.
No,
it's glue.
We don't have that yet.
Okay, all right, but maybe one day. What is a case that stayed with you medically and then other one that stayed with you emotionally?
Ooh, I think so. A recent case that I had was it was a young patient with a BRCA gene mutation. So for people
BRCA
who don't
gene,
know, the
yeah.
BRCA gene, that gives you this extremely high risk of breast cancer in your lifetime, and all the medical suggestions are that you should have a bilateral prophylactic mastectomy. So she was young and she was doing her due diligence, and she had found out because her sister had been diagnosed with BRCA that she should get tested. So she got tested, she was positive, and she was coming in to see the surgical oncologist and to see me and to, do all these things that she was supposed to do. So we were already planning her stages of reconstruction because, of course, if someone comes before they have cancer, there's a lot more flexibility and you can sort of tailor things better. And then she got breast cancer. As we already had her first surgery planned down the road, she got breast cancer in that time, which is, of course, that's the risk with BRCA, that you have this super high risk of breast cancer at any time. And she was, I think, not even 40. So that was hard because she was already trying to do the right things and was going to get a prophylactic mastectomy that then turned into a cancer mastectomy.
So prophylactic means like
Preventative
yeah.
Versus after
the fact.
Yeah.
I teach health comm at USC, and one of the things we talk about is like the celebrity influence on these type of decisions and awareness.
Huge, yeah.
And it made me think of Angelina Jolie's op-ed in the New York Times.
Yeah.
Was it like over a decade ago? My Medical Choice.
Yeah.
Where she talks about exactly that. She had the gene mutation, and then her mom passed away from breast cancer, and she was talking about getting this preventative double mastectomy, which then really skyrocketed women getting tested for the gene and also like opting in for the surgery.
No, 100%. And it affects, I mean, my heart really goes out to those patients because it affects so many parts of your lives because they also need hysterectomies. Their ovaries out.
She got that later. That was the second piece that she wrote about. Yeah, she had
And
this
it
whole
depends
thing.
where you are with your childbirth because do you need fertility preservation? Like, are you still trying to have kids and you're dealing with all of these surgeries? And so it's a lot for, imagine it's like it could be any of us or our friends dealing with all of this in their mid-30s.
Who helps a woman in that situation in terms of caregivers? She would have her doctor and all that, but like, what about the psychological aspect? Are there any resources out there or any professionals that can help them through this hard journey?
It's one of the things that I actually really want to advocate for here because I think that every breast cancer patient should be plugged in with like a clinical psychologist or someone well-versed in these things from the start because it's so emotional and there's so many pieces. But so it really depends where you're at and what institution, what city you're in, because there are some resources, psychiatrists, social workers at different hospitals that you can talk to. Here we have a high-risk clinic where there's a clinic dedicated for patients with a high risk of these cancers. And then we also have a survivorship clinic. So talking to patients years after their breast cancer diagnosis to see what they're still dealing with. But I think it's an area for a lot of improvement because I think the mental toll of it is we still don't, we don't have a good handle on that.
It's so hard to be a woman, I feel like.
It's so hard to be a woman.
It's like so healthy or unhealthy. It's really difficult. Like I'm not really familiar with the field, but how does that patient even go through like work and life? Like, do they get time off? Do they get any type of support from the government, from their workplace? I don't know. It sounds like
totally,
you need a lot of support.
And your kids, if you do have kids, what's happening with the kids? And you're in the hospital and you're having multiple surgeries. No, I think there's a lot of like work and support that needs to be done and more investment in women's health.
And you need a good village.
You need a village.
Yeah, we're
Look
talking
at
about that. We
Most
really
important.
Look at that. Look at that.
Well, and
look at that transition we did right there. No, but for real, you need a solid
They
village.
have done studies that show that social support is one of the major determinants of how well patients do after surgery.
Yeah, and in life.
Yeah.
I kind of in class teach my students how they can be a good caregiver if someone is sick in their village, or how they should be asking for help or, ask for support if they are the patient. It's like
yes, both of those things are so important.
It's so hard to ask for help too.
It is, especially when you have been a woman that is taking care of a lot of other people, because we take care of our parents, we take care of our kids, we take care of so many people in our lives. And then when you need to be taken care of, it's really hard to know how to do it.
And everything falls apart a little bit.
A little bit, yeah.
Everything.
Yeah.
I mean, everyone survives at the end of the day,
Right.
but everything falls apart a little bit.
Is exactly how it feels. Yeah.
Are you type A?
So type A.
Yeah, we're all type A.
We're all type A.
Like all these. Yeah, I was going to say, because like I am so type A, and getting sick is the worst thing to happen to me.
Gosh, yeah.
Like being sick in bed. And my husband's like, Naz, you're sick. Just take a day. And I'm like, well, you don't know what this means. Like,
Yeah.
What are you feeding the kids? Did you change a lot? Did anyone wipe the counters? Like, it's literally, I'm like, my mind is there instead of where he's like, you should just be in bed and resting. I'm like, what is
100%.
that? What does that mean?
No, I know. There's some days I just feel like a smartphone with like 16 apps running, and they're all running in the background simultaneously, and I can't change that.
No, that's exactly how I feel all the time. If someone asked me like, oh, what did you do today? I did a podcast. But if I actually told you everything I dealt with
Exactly.
from like 5:30 a.m. to now, it would be psychotic.
Right.
In the garage, I was looking at like windows that fit our new ADU's U factor and why is it too high and what is a U factor? I'm like, while holding these, like, what is a U factor? Why? Why is this happening? Okay.
It's so typical.
All right. I want to talk about you and your family life. So you kind of talked about how this pregnancy has been a little bit harder, but what does that look like? I said family, but now I'm going to ask about work. What does that look like at work for you, being a surgeon who is pregnant? Are you standing for long hours? Are there any accommodations? Do you not need any special treatment? How does that look like in your body? Walk us through a day in your body.
I mean, I think it's so different depending on your pregnancy. I really have been fortunate that I haven't had medical complications and everything has been okay. And then I think it's sort of what you're conditioned to deal with, because I've been doing this, for a decade now of just standing and operating, and we do, 8-hour surgeries. So do I need more breaks? Definitely. Do I need to pee and drink water? Yes. But I think you just get used to doing the things that you're expected to do. And luckily, I like my job. So I
Good.
Yeah, right. None of this would work if I didn't like my job. So I still want to be doing all these things. And luckily my body is cooperating. But I think, you have to, at some point you have to kind of turn down the gas a little bit and listen to your body and rest. And there's, nights where
yada,
I'm
yada,
exhausted.
yada. How does one do that?
Right. But then it's so hard too, because you don't want to disappoint people. You don't want to cancel things, and you don't want to not be, you don't want to not be present at work or at home. So that's hard.
Do you need a water break?
Right now?
Yeah. Do we have water for our surgeon?
Speaking of water, I mean, I probably should. Let me just make sure no one's dying.
Make sure there's no code blue.
Yeah,
You don't get those, right?
Usually not.
Would you know what to do if you got one?
Yeah, you just give epi and chest compressions.
I have a funny story. So my mom is so bad at treating us, like me and my sister.
Yes.
But really good at treating anyone else. Like the grandkids, fine. River lost a toenail and my mom was just like, dressing it every day. It's fine. But if I had a boo-boo, my mom like, show it to your dad. Like, can't. So I fainted from pain at the age of like 7. I was fighting with my sister. Long story. I got injured. I fainted. I came to, and my mom was like freaking out over me, like, get the neighbors, like, get the, doorman. And my sister's like, Mom, you're a doctor. And then she's like, yes, I am. Like, lifts up my legs. And I'm like, this is insane. Like, chief of ER, mind you, literally deals with like gunshot, like literally like
the most emergency,
the worst things. She like lost herself because I was, on.
I totally get it. Oh, yes, that doesn't surprise me at all.
It surprises me though. Come on, get it together.
It's so different when it's your own kids.
I bet.
Yeah.
I bet. Do you volunteer as tribute when they call for a doctor on the plane?
So it hasn't happened yet. I would raise my hand and I would just pray that it was something that I could be useful
You
with.
would be, because you're a real legit
I don't
doctor.
know. I mean, I'm not a cardiologist or an anesthesiologist. That's who you want. The doctor's on the plane.
Take
You
notes.
want the cardiologist or the anesthesiologist. Those are the good ones.
I like the PhD jokes on the plane. Have you ever seen one of those? Like, do we have a doctor? It's like, and then you go like, oh, I'm not that kind of a doctor. It's like, we have a research submission in 5 minutes and the p-value is not adding up. And there's like, oh, I can help you with that.
I haven't heard those. That's perfect.
Those are good. My parents now are more, they always say, I'm a doctor, but now they're more inclined because now airlines have perks.
Oh,
like
yeah.
they would give you miles,
Yeah.
or Lufthansa gives you 700 euros to spend in the duty-free shop. So if you're flying
Ooh,
Lufthansa,
that's quite a perk.
you want to raise your hand, honey.
No, they should be rewarding. I think before people
know.
also worried about the liability. They say they're a doctor and then so-and-so dies of their heart attack, then they're, I don't think they want to be responsible.
Yeah. Once my mom landed a plane,
Stop.
told the pilot that they had to land because
my
the patient wasn't doing well. And they landed in Iceland.
Oh.
And she calls me, she's like, what are the odds? I always wanted to see Iceland. Mom, you could just tell the pilot where to land next time.
Wow.
So I'm giving you all these
What a
perks,
silver
honey.
lining.
Next time you're flying, keep these in mind. As a mom of two, I'm often exhausted. What does exhaustion look like for you? And what do you do to snap out of it?
I mean,
Snap out.
no, I know. I think you go home and you do your best, but there's some nights where it's just you're in bed by 8 p.m. and, I have early mornings. So at some point, I think, you have to lean on your partner. And I'm lucky that I have a super supportive partner. So it's very much shared sort of, it's never fair. Like when people talk about marriage as 50-50 or it's never, not possible. But you just lean on each other when you need. So it might be 80-20 for days, but then, someone picks up the slack when you need it.
That's such a good point. I think Brené Brown do you know who she is? She is, I think, a PhD in sociology, has a lot of books and, TV shows. Like she's great. And she has this little trick that she does. She says, every time we come home, my husband and I from work, we tell each other what percent we're at. So like, I'm at 80. Oh, I'm at 70. Or we're good today. Or like, I'm at 20. Oh, I'm at 60.
Oh, I
can pick up
that.
the slack. So I think that's like a nice little trick.
Sometimes I come home and it's 5 and I barely have enough, to like eat and go to bed. And that's okay, I think.
How do you split up childcare with your husband?
So our son is in daycare, and if I don't have an early morning or a late case, then I try to do drop off or pick up. But, it's 8 to 5. It's not surgeon hours. My husband does most of the drop off and pickups, and he's happy to do it because he knows there's no sort of guilt that I can't do it.
Yeah. What is maternity leave going to look like for you?
It'll be about 3 months, something like that.
Just
Kind of.
3? By choice? USC.
It's sort of both. I could choose to take longer, and then you're paid less as it goes on. Well,
wait, really? Are we exposing this huge institution
No,
and
not
their
at all.
terrible maternity leave policies?
I think it's reasonable, and I think a part of me would go crazy if I was not back at work within 3 months. So
Let's be
I
honest.
think we're on the same page.
That's great. How do you feel present with your family when you go home and you can disconnect from work? Or do you ever have to because I remember my mom bringing cases home. Do you ever have to do stuff
I
like
wish I had an answer. If you have an answer, let me know. It's really hard. That's the thing I struggle with the most because I don't want to always have part of my brain at work when I'm at home. But it's really hard because when you take care of complex patients, there's a lot of complex issues that are going on sort of all the time. I mean, when you work at an academic hospital, you have patients who are dealing with things all hours of the day and on weekends. So it's hard for me to totally disengage, but it's something that I know is healthier for me to be able to say, okay, you know what? There's nothing I can do right now. I'm not at work, so I need to just not perseverate over work, but it's really hard.
Do you ever get calls where like, can you come back to the hospital and check up on a patient? Does that happen?
As you're in practice longer and you get a little bit sort of more in your own flow and sort of know what you're doing, I think that happens less frequently, but is always a possibility of that, especially it's sort of the more high stakes the case or whatever it is that you're doing, the more you're anxious or worried about things going wrong. At some point, you have to step back a little bit.
Do you have some patients who feel so close to you that they only want to be seen by you, for example, for like checkups?
Yes.
So what happens then?
That's another sort
It's
of
a
balancing
tough-
act. Yeah, because
tough
you want
situation.
to be there for them and you want to help them, but I don't have the time.
You can't.
I would need like 12 days a week to do all of that. You know, we try to tell patients like sometimes I'll see you, sometimes another member of our team is going to see you. And, you know, I think in general, patients are understanding about it. When you have hundreds and hundreds of patients, everyone has their own flavor.
I remember another thing, again, from my childhood. I have a million stories like this.
I love that you got the
No, it's
the
so funny.
child
I
of
was telling
doctor
Blake when we walked in,
life.
I'm like, oh, honey, I'm home. Really, when I walk into a hospital, I get this weird sense of like home. And I'm
so
like,
funny.
this is what
That's
they're
so
trying
weird.
to get patients to feel, you know? But they can't. Like, what's missing? An entire childhood in the hospital.
Right, you have the secret sauce.
No, but for real, like my sister and I would just be in the ER hanging out. Like the paramedics would make us, you know, those like balloons, like helium balloons from the gloves. And we would have like fake photo shoots where we were on braces and pretending we're like injured. And like, seriously, I have these photos.
That is
and
hysterical. That would be
like
so illegal now.
No, for real. I mean, also, this is another country. We won't be naming countries here. But, or like there would be like a serious patient getting rolled in and they would like shove us in the doctor's room. Like,
Wow.
like that's how I grew up.
Yeah.
So hospitals give me a weird sense of like security, safety.
I love that.
Love walking
Maybe that'll
in.
be Auden's life when he's
I
older.
think it will be. And I think he's so lucky that he has you as a doctor mom. I feel so lucky that I have my parents as doctors because you're right. Like it's so hard to get care.
Yeah.
Now you're on my speed dial too. Have I ever asked you for a
and
prescription? I
love
probably have.
that. No, I wanted to be a resource for my family and my friends. Like I really wanted that because it's so scary and like you don't know how to navigate it. So I was just like, well, if I do it, then people can ask me.
Yeah, exactly. And I think that it is a true privilege to have that, especially here. I don't know if I told this story in another podcast, and if I did, we'll cut it. But my first time really experiencing the healthcare system in the US was at Princeton as a freshman when I broke my foot. Do you remember?
I remember this. You were on the golf cart.
Oh, I had a golf cart, honey.
for
but like
weeks.
also I was looking at our
John
Facebook.
Mollers would carry you around.
That's an iconic photo.
Yes.
So until then, back home, anytime I had a medical emergency or anytime I had to see a doctor, like my mom would just bring me to work or it would be just one phone call and they would like squeeze me in. So when I broke my foot and I couldn't get an ortho appointment for 3 weeks, they told me the closest, the earliest is in 3 weeks. I'm like, my foot's broken. So what am I supposed to do for 3 weeks?
Wow.
And then I was like, the only thing that works here is crying. So I started crying. And then suddenly there was an appointment the next day. It just appeared out of thin air. Crying works.
For doctor's appointments and speeding tickets.
Yeah, just cry. And they don't know what to do with your feelings. They're like, okay, I did have this in the back pocket. So, and then I got that, I got that golf cart, which was pretty sweet.
I remember the golf cart.
It was sweet. And my dad was like,
I think we were all jealous.
And
Not that you broke your foot, but that you had a golf cart.
I would drive you guys around.
Yeah,
have you ever been?
I think you would drive us because we were so far away from.
Were you in Forbes?
We were in Whitman.
You were with Whitman with me. So same residential college, I would drive, give people rides.
Yeah.
I would give people rides to the street for partying.
Oh my
That wasn't allowed after. When it's dark, you're not supposed to, but I did it and I was a reckless golf driver.
Oh
it was
my God,
so
that's
funny.
so funny.
And then my dad's like, oh, the Princeton difference. They gave you a golf cart. And then a bill arrived for thousands. And my dad was like, what? No one told me that.
They billed you for the medical golf cart?
Yeah. Apparently, if you're an athlete, it's free. If you're a non-athlete and you just broke your foot at a frat party drinking, it is your own goddamn fault. So,
I guess I see the justice in that.
Right? But yeah. So let's talk about the village. So what does the village mean to you? And who is in your village that make your life possible?
Definitely, I feel like it starts with your partner. like that's like so huge, and that is the biggest support system and like the thing that makes my life work. In a job like mine, you have to work with people that support you and can be there for you because there's an emergency and I can't deal with it, or if, I am out of town or whatever it is, I need partners who are going to be supportive. And, I'll be gone for 3 months when I have this baby, and instead of moaning and groaning, my partners are like, oh, great, take all the time you want, we'll cover your patients, we'll do what you need for like this line of work. That's super important. And then, grandparents are not, well, like my parents, but the baby's grandparents, that is so essential. Like it's a double-edged sword because no one is like, I want to spend my 30s seeing my parents all the time, but it's just so helpful. And I think if you don't have, we don't have a nanny, so having grandparents in our lives just makes it possible to get a break or sort of, have a little bit more flexibility when things are really crazy at work.
It's such a luxury to have.
It's such a luxury.
And like none of us have that anymore because everyone lives away from home. Like, my parents are across the world. My mom comes and helps us out for a few months every year, which is amazing. And when she leaves, I'm like, but also.
Yes. That's. Yes.
It's like so amazing,
so
but also like
yeah.
so excruciatingly difficult sometimes.
Because no one can push your buttons like your parents.
Oh my God, the micromanagement. Yeah. I tell her, get out of my case. Watch the children, get out of my case.
Right.
Or like oh God. Sorry, Mom. But like, we'd be like together, my husband doesn't speak Turkish. And then she'd be like looking at him like, smiling, and then like tells me something in Turkish that is like completely different tone, completely different context, like, borderline mean. And then keeps like, I'm like, and then my husband's like, what happened? I'm like, it's okay, nothing. Right. I just got like stabbed under the table, and you were just living,
exactly
your beautiful life, and I'm suffering here.
Yes, especially foreign parents, which we both have. It's a whole thing to deal with. So yeah, you take the good with the bad.
I guess so. I talked to ChatGPT about this, and it's like, that's not free help. You're paying with your emotional well-being.
Oh, nailed it. ChatGPT never misses.
I know you talked about how supportive Hans is, but can we get a little bit more specific? What does that really look like to have a supportive partner?
He's so great. You know him. He's just so great. Like I said, I do longer surgeries, and my days are unpredictable because it depends what comes up. And, we get asked by a lot of other specialists at the hospital for help with things because they have these problems and they need a reconstructive surgeon to help them put things back together. So the days can be unpredictable, especially if I'm on call. If I come home late and it's a surprise or something comes up at work, like his question is, what happened? Like, are you okay? Is the patient okay? Like, what did you have to do today? It's not, why are you late? I thought you were going to be home sooner. I had to deal with the baby. So he is like fully engaged in what's going on with me. And he knows the like emotional labor of being a surgeon and taking care of a lot of people. So that's just huge.
I agree. I don't know Hans that well, but whenever I see him, it looks like he has such a special relationship with Auden too. Like he's a good dad.
Oh, he's the best dad. Yeah. I have so many friends that whether they know Hans really well or they just kind of know him peripherally, they will be like, oh my God, he just seems like the best dad. And I'm like, wow, it's that obvious.
Yes, it is. It's very obvious.
Yes. And he spends way more time with, our son than I do because he has more time. Mm-hmm. And they have the cutest relationship, but I don't feel bad about it because I know I do.
You shouldn't.
I'm there when I can be. I'm still there a lot, and I'm there when I can be, but I love that they're so close.
I agree. I think that's also such a privilege to have a close relationship with especially for our generation. It's like a new thing for dads to be taking care of the kids.
It's so cool. I love it. And I can't believe, when you talk to older dads, and they're like, I never changed the diaper, I never did this. I'm like, what?
I know.
What was happening?
I also teach about like elder care, end of life care later on in life. And then research shows that dads who have been more hands-on with the babies are actually much better caretakers for the elderly in later life because they're so used to the messy parts of caretaking too.
Yeah.
They're not just doing like, I don't know, the bills. They're actually like in there, hands-on work, literally changing diapers and feeding whoever they're taking care of at that point.
That totally
It's
makes
important,
sense,
right?
yeah.
I have a weird logistics question here that I want to ask. What happens, because this happens to me a lot. What happens if your childcare falls through? Which is less likely in your
gosh.
case because you're at a daycare.
Oh, yeah, or Auden gets sick. That's like we're always waiting for the other shoe to drop and for, when is the illness going to come around? It's just a mess. It's crazy. So, best case scenario, it's a day where I'm a little more flexible and, I can be at home with him for a little bit and then Hans can try to work from home or we try to, or he takes a day, but it's so hard.
Yeah, and that's like one day. What if it's like
Right,
a 4-day
I
thing? Then what do
know,
you
I
do?
know.
I know. It's like a whole thing.
It's
so
so
hard.
hard.
It's so hard. I want to talk about something a little different and lighthearted because I think you and Hans have the best style when it comes to clothing. Everyone's
That's
gonna be like,
so
what are you talking about?
generous.
It's not though. You guys are always in like the coolest, but like effortlessly cool, like outfits.
Oh my God, this is
they're-
too flattering.
But you can tell it's like these are decent pieces of clothing. Is that intentional? It has to be.
Oh my gosh.
Don't tell me it's not.
I think what's nice is we both have a similar ethos. We don't want to buy clothes unless we really like the piece and we want to wear it forever. So that's like what we look for both of us. So then that's nice because then you get a lot of things in your wardrobe that are cool, sort of more, the goal is they're more timeless
They're
things
fancier.
that you can put mix and match. It's the very anti-fast fashion.
I love it because you guys look great, but I think it's also like
That's so sweet.
your home too. I haven't been to the new one, but I've seen
know, we need to-
pictures. I know.
I can't get you to drive to the east side.
I'm here, honey. I'm here.
That's true. You did
I'm
it
here
for this.
today. Tell me about that process too. Hans is an architect, and clearly both of
Yes.
you have really cool style. How did you design your home? How did you decorate it?
Oh, yeah. I mean, I've always had an interest in sort of the more fashion side of things, but the house is 100% credit to him because he's so kind of particular and so thoughtful about design and he wants everything to be so cozy and curated. It's amazing. So I just get to live in this house that's just beautifully styled all the time.
I just show up.
Yeah, to our house, I just show up.
I remember Instagram stories of like how he painted Auden's room.
Yeah.
Used a special technique.
Yeah,
it looked so
he
beautiful.
hand plastered the entire room to make with like Roman clay.
That's it. The clay.
Yes, it took like 2 weeks. He was covered in paint every single day for 2 weeks. No one could use the room. It was very disruptive, but it was so worth it. And now Auden has this like magical little
It
room.
literally looks like this like fancy like yoga retreat resort from like in like Mexico, or
I
it
love
looks
that, yeah.
really good. I mean, I love it. I love it. I mean, we're here. Listeners won't be able to see it, but you'll see it on the video. I'll post pictures. You are also surrounded by Hans's art here in this
Yeah.
office. Tell me about these pieces. Did you just grab them from home? Like, or did he paint them for the office?
He does like different collections, just throughout his life. He is also a painter, so these are all from just different time points. And when we were moving, because we moved recently, I was like, what do you not have a good spot for at home, and what can I take to my office? So these are the ones that I have now. Ironically, that wall keeps changing because other surgeons will keep walking into the office and asking to buy whatever is on the wall. So this is like the third thing that I've put up there because
Is this a little exhibit? Do we bid on pieces here?
right, because it's like people just walk in and they're like, oh my God, I really like this.
Neat.
Like, would you sell this? And I'm like, yeah, he sells his art all the time.
That's amazing.
Yeah, but then I keep having to find a new
Ugh.
one. But it's a good problem to have.
Amazing. Who knew? Tell me about what you do self-care is such a cliche term, but to take care of yourself. What are some things you absolutely have to do so you can show up for, Auden, for Hans, for work?
That's a hard one because I feel like when you're a surgeon and when you're a mom, you are like, it's like your family first and then your patients and then you are somewhere down that list. I'm like terrible for self-care. I
You
don't
have
know.
to do some self-care.
I am trying to think. I drink water. Is
Oh
that
God, come
self-care?
on, that's it? Emma, how are you doing?
Well, I don't do makeup. I don't do manicures. I don't do hair. Like I
That's not self-care, that's hard.
right. Okay. I don't do that
a
stuff.
burden.
That stuff doesn't make me happy. I'm trying to think.
Massages, walks?
I should get massages.
You're pregnant.
I know I should
That could
get
be my
massages.
little maternity present for you.
You don't need to do that. I think there's more that I could be doing, but I think I'm not at that place yet where I've figured out how to optimize.
You're pushing through
for that. Yeah.
Maybe this will be
Maybe
a wake-up call, Emma,
Yes.
this podcast. You call Hans. Honey.
I have nothing for
I
the
have zero
self-care
self-care.
section.
Well, superhuman. So
I go to Erewhon and get the smoothie every once in a
that's
while.
okay. Which
Okay.
smoothie do you get?
Usually like whatever they're rotating through.
That's
Yeah.
good. That's
Yeah.
good.
Does
That
that
could
count?
be. It could count.
Okay.
I mean, it's
That's all I
better at
got.
that price point. Better count. All right. As we wrap up, I always do these two fun sections. One's a rapid fire.
Okay.
And the other is a this or that. So we're going to start with the rapid fire section. Whatever comes to your mind first. You don't have to think about it.
Okay.
Sometimes I ask hard questions though, and people have to think about it, but yours are not
geez.
that hard. Okay. First thing you do after a long surgery.
Call the family.
Your happiest time of day lately.
Mornings.
Why?
That's when Auden wakes up and he's so happy and excited about the day and just everyone's at home.
One thing you wish you could outsource from your life.
Cleaning.
There is a way
I
to
never
outsource
want
that.
to do it ever again.
Okay, there's a way to outsource that. Last time you felt truly rested.
2015? I don't know.
Girl! A recent moment you wish you could freeze.
Auden saying I love you.
I love you, mama. Your favorite place to shop for clothing. Spill it.
It's so erratic. I don't have a good answer. It used to be Barney's, but the Barney's is gone. So
but we get
R.I.P. Yeah.
Okay, we get it. Now I feel bad asking this question. A little luxury you never skip.
The
Is that your smoothie?
Could
All
that
we
be the
have-
Erewhon smoothie?
We need to find one more thing, Emma, or I'm going to start crying here. Because I think of my mom, and it makes me sad.
What were her luxuries?
This, nothing.
Yeah.
Not even Erewhon.
She didn't even have Erewhon. So I'm doing
cup
better
of
than
tea.
her. Oh, I do love tea. Okay, add that.
All right.
Add that.
All right. This or that. OR day or clinic day?
OR day.
What is the difference? Clinic days, you see patients back to back, and
Clinic day, yeah, you're gonna see like 20 patients. OR day, you get to operate. So that's the fun.
no human factor. Just kidding.
Well, you go into this line of work because you want to operate.
Early mornings or late nights? I guess
Early mornings for sure.
we knew that one. Conference travel or being home?
Being home.
But your conference travels look bomb, especially from Hans and the baby side.
They make it fun. So I bring them on to all my conferences because otherwise it would suck. So they make it fun.
I loved going to conferences with my dad.
Yeah.
Because they're always so like curated. Don't you have like gala nights and dinners?
You do, but think about who do you want to spend your time with? Like a bunch of people having these sort of superficial conversations or like the people you love?
Oh, you're going back to the conference versus at home.
Yeah.
No. I get that part. But you don't enjoy the conference perks?
It's fun. It's fun for, 2 days.
Maybe it's more fun if you don't have to do the conference too.
Yeah.
Because I always show up and like, oh, we're skiing? Great. I'll
Right.
ski.
Well,
Like,
that part is great.
oh, we're sailing? Great. I know. I miss being a teenager like that. Structured routine or go with the flow?
Structured routine, always.
Logic or intuition?
Logic.
Sleep or alone time?
Sleep.
Sleeping alone.
Sleeping alone.
For me, I still sleep with River, so there's that. Does Auden sleep by himself?
No.
Okay.
We're in the same boat.
All right, that's a myth. All right, great. Well, thank you for this, Emma.
This was
is
so fun.
We have to do it again.
I
You have
can't
to be a
believe you
repeat
came
guest.
all the way down to the hospital to hang out with me.
I told you, it's home, honey. Love hospitals. Love
You're
hospitals.
such a weirdo, and you should
I
talk
am.
to someone about that.
I should, right? Where can people find you and your work? I never asked about this, but you have a practice, no? Like,
Los Angeles breast specialist, but most patients just find me by name.
and that is Emma.
Emma Koesters.
Koesters, not Koesters. It's Koesters.
Pronounced Koesters
Right.
at USC.
Fantastic. Thank you. I got to do my little outro. You can listen to episodes of The Village wherever you listen to your podcasts. And don't forget to like this video and subscribe to our channel.
That was
Toodaloo.
perfect.
Was it? It better be.
That was very professional.
And they better follow, and they better share, and they better listen. See you next time. Adios.
Bye.